the crisis brewing across the world over, the efficacy or otherwise of the Oxford AstraZeneca COVID-19 vaccine has yet to catch on here in Nigeria and the rest of Africa. The vaccine has come under intense scrutiny after claims that a jab of it usually causes blood clots in a substantial number of the recipients. So why are we not alarmed enough in this part of the world to begin to consider our options in the face of these startling revelations? Joining us now to have a conversation is Dr. Rukevwe Ugwumba, consultant on family medicine, associate professor at Saskatchewan Medical School in Canada, and fellow College of Family Physicians of Canada. Dr. Ugwumba also served as special advisor on health monitoring to the governor of Delta State here in Nigeria. Welcome to the program, Dr. Ugwumba. It's good to see you again.
Hello, good morning.
Good morning. Thank you for joining us. Well, very quickly, if you can hear me, we would like to have your take on this controversy over the AstraZeneca vaccine. Is it really politics over science, as we've been told by some commentators on the subject? And apart from the AstraZeneca vaccine, the 4 million doses that Nigeria has received so far, what other steps do you think that Nigeria should be taking now that there is a vaccination program nationwide in the country?
Yeah, hello. It's nice to be back here again. Not in your Lagos studio, but I'm in Abuja, and it's really refreshing. I'm sorry about my voice. I just had a long weekend of a funeral. One of my siblings died, so we buried. So excuse the huskiness of my voice today. Now, the AstraZeneca vaccine, very controversial. We know, for example, that many countries have rejected this vaccine based on side effects. I'm talking about blood clots. And based on efficacy, I'm talking about not covering for the Brazilian or the South African strain. So why are we taking this in Nigeria? We saw the other day the president making a big show of it, having a shot in the arm and saying, and then the vice president taking the same AstraZeneca vaccine. And we're wondering, why are we taking a vaccine that is being rejected by other countries? The truth is, honestly, I believe that we're just being cheap. The reason being, we don't really have the facility to take on the correct or the most proficient of the vaccines. I'm talking about the Pfizer vaccine, which requires a very deep cold chain of minus 37 degrees or more. And so we don't have that facility, and the AstraZeneca vaccine requires a little bit of a less, the less incumbency in terms of from the place you store the vaccine to the arm, it's less expensive. So I think that's why we're going with the AstraZeneca vaccine. To be honest with you, as a physician, any vaccine for COVID is better than no vaccine. So we know, for example, the Oxford University produces a vaccine, and it's being used widely in the United Kingdom. And so a lot of people are getting some protection from it. But we know that since the beginning of vaccine production to date, there's been variants of the virus. So the new strains coming up. And so we need to do something about that. For example, every year we get the influenza virus. And the influenza virus means that you get a shot in your arm every year for influenza. And every year we make the vaccine. So for example, right now, this is March, we start making vaccine for October for the influenza virus. And we guess how the virus is going to mutate. So we need to give you a booster. And we think over time, all the people who have got vaccines every year for influenza will be protected in the long run from a super bug. For example, when we had the avian flu. So getting the vaccine is actually protective overall, because the vaccine is not perfect. Even the Pfizer vaccine tells you 99% protection. 99% is not 100%. So for sure you would get infected, but we're looking for no deaths and no severe infection. That's why we're taking the vaccine. We know that getting COVID will protect you maybe up to 6 months, but we don't think it will protect you from the new variant. So we still need the vaccine. So even if you have had COVID, you still need to take the vaccine. What are we looking for? Herd immunity. What is herd immunity? threshold whereby the virus will be, I would say neutralized, where we cannot now get new infections to kill people. So we're looking for no deaths from the virus. We know that the virus will kill people. We know that the new variants are more infectious. More infectious means more deaths. Okay, so I congratulate Nigeria for getting 4 million doses. I don't agree with the fact that they have to do a welcome party, which I saw on the internet. I don't know if it's true or false, because of 4 million doses, where we have over 200 million Nigerians. 4 million doses will not get us to herd immunity. And for sure, the AstraZeneca vaccine is not the way to go. Now, I've just come from Canada, and I've had my own shot in my arm for the Pfizer vaccine. And that's a 2-dose vaccine. The AstraZeneca is a 1-dose situation. And even in Canada, we have several companies approved for the vaccine. So we're not just using one company approach. So we have the Pfizer, we have the Moderna, we have AstraZeneca, and several others. We're still looking for approval for the Johnson & Johnson, which we think is the cheapest and the least cumbersome for delivery from the cold chain store to the arm of the patient. So Nigeria, congratulations, but you have not done enough. It's not enough. For sure, you need to get multiple doses. You need variants of the what's it called, the vaccine. You need to get other vaccines, not just one type of vaccine, because we know the virus is changing, and we know that one dose is not going to be enough.
Right.
So we need to make more effort to get other companies.
If I may come in here, I'm looking at a report from the Medicines and Healthcare Products Regulatory Agency in the UK, which says there are actually more incidents of blood clots with the Pfizer vaccine than with AstraZeneca. I'm going to tell you, up until February 28th, there have been 38 reports from 11.5 million doses of the Pfizer vaccine, compared to 30 reports from 9.7 million AstraZeneca vaccines. So your information is contradictory to this proved medical report. So it's not a question of the Nigerian government being cheap, as you suggest. And we do deserve to commend the Nigerian government on every step that we do take. It's important to do so. The AstraZeneca vaccine is also a 2-dose vaccine. The South African variant does not arise here because we don't have that here from all information. They are relying on Johnson & Johnson's vaccine, which is a 1-dose vaccine, but that has not arisen here. As and when due, I'm sure things will be reconsidered, but we do deserve, I feel, some commendation. But I want to also ask you now about the blood clots, which I must repeat and I must stress. There's a higher incidence of blood clots with the Pfizer vaccine, according to this report from the UK. In the event that people are concerned about blood clots, even though, according to the WHO and others, the incidence of blood clots are not particularly alarming at all. This is more politics than science. This sort of smear campaign is politically driven. But in the event that people are concerned about blood clots, what do you recommend? Because they're natural blood thinners, certain foods like ginger, certain medications, over-the-counter medications like aspirin. In your medical opinion, is that enough to sort of balance out that risk, or not to bother at all with natural blood thinners?
Okay, first of all, I would say that who's doing the research, okay? So the AstraZeneca vaccine was produced in the United Kingdom. Of course, they're going to promote their own vaccines. I'm not trying to discredit the research.
Are they going to fabricate data?
The Pfizer vaccine... No, not fabricate data. They're the ones promoting, they made the vaccine, and so they're looking at the other vaccine to promote their vaccine. Okay, so you're not going to look at just the research from the UK. You're going to look at the research from all over the world.
What about
millions
WHO?
And millions and millions of doses of the Pfizer vaccine have gone out in the United States. And wait, just excuse me, you made your point and I'm making mine. I'm saying that 38 people getting blood clots in the United Kingdom from the Pfizer vaccine, and they have rejected the AstraZeneca vaccine in other countries where they have never rejected the Pfizer vaccine, should make you think about that, okay? Like I said, in all over the world today, Pfizer vaccine is #1 in terms of choice, the vaccine of choice. And it's a very, very expensive vaccine because it requires a deep cold chain, which we really don't have. And it does require movement from the storage to the arm of the patient, where a lot of vaccine could be wasted. Because once you thaw the vaccine to get into the arm, and it's not utilized, it's wasted, and it's very expensive to do that. So again, I'm not just saying Nigerian government is cheap. I'm saying that they went to the path of least resistance, and I stand by that. Okay, I know, for example, like you said, in the United Kingdom and in the United States, different vaccines are being used. Even in the UK, they're using the Pfizer vaccine till now. So I won't go into, like I said, it's a new era in terms of what we are finding out, and more research will come out. But I'm saying because of side effects, people will not take the vaccine is a misnomer. Okay, people are dying, millions of people have died from COVID. And we know that the natural infection will not give us the satisfaction of herd immunity that we're looking for. So everyone needs to get the vaccine. At least enough people need to get the vaccine that will provide herd immunity. Okay, so we're looking into that. The very rare instances, we don't think the vaccines are more at risk than any other vaccines. We know that it was fast-tracked because we're really in a hurry because people are dying in millions. And so that's why we're going with any vaccine. Even in China, the Sinovac vaccine. In China, for example, today, there's no deaths from COVID. And lots of countries haven't really accepted the China vaccine. For me as a physician, I want to protect my patient. Everybody needs to get a vaccine, whichever one you get.
Okay, great. Dr. Rukevwe, we'll come back to you and we'll talk some more about this. We're right back. Okay, welcome back. We still have Dr. Rukevwe Ugwumba, consultant of family medicine, associate professor at University of Saskatchewan Medical School, and fellow College of Physicians of Canada. Right, let's go straight to it this morning real quickly. I want to talk about, logistics now. How we're transferring these vaccines from state to state. We're pushing the vaccine around. What should we be doing a whole lot better with that? And secondly, I want to talk about data collection, how to follow up on people that have taken the vaccine, to reactions and things like that. To be able to have a compendium of a clinical, study or a clinical trial. I want to know how that, is going, or what advice we can take as a result of that. I mean, those are the things we want to talk about. I want to talk about that this morning. What's your take on that?
First of all, like you said, I commend the federal government for the initiative to get vaccines through the COVAX. But the truth is, it's really insufficient. I mean, you're talking 4 million doses for 200 million people. So each state must do something about it. And we know that the vaccines are different, how they're stored from the storage to the transport to the patient. Okay, so the state governments need to take initiative. I know several states are looking into getting their own deep cold chain storage. I'm talking about for the Pfizer vaccine and the other ones. But in general, I think the effort is not good enough. I think it's not fast enough. And I think it's not, how will I put it, emphasis has not been made on the importance of the vaccine. We're looking for herd immunity, and we know that the virus would not protect us. So even if you've had COVID, you will get COVID again, and some people have died from the second wave of COVID. So having the infection does not guarantee a long-term immunity, so we need the vaccine. Now, so that's what I need to say about that. So we need to do more in terms of procuring more vaccines. I believe we need to procure various vaccines. It's not okay to just get one vaccine because the virus is mutating. Even the Pfizer vaccine, they're talking about a booster dose, even after you had your 2 doses. Because just like the flu shot, we anticipate variants, and we're going to do booster. So even if you have it, and it protects you, it may not protect you from the mutations, okay? So we need research is going on regarding that. So the Nigerian government, both federal and state government, need to look at procuring various types of vaccine. It's not good enough to get one type because we know it doesn't cover all the strains, and we're looking for herd immunity. That's what I have to say about that. The second question was about how do you do the logistics from the freezer to the shot in their arm. Again, we need a lot of people to get trained on giving the shots. We know that there's not enough doctors or nurses that could give this vaccine. So we need fast training for even, we call them CHOOS, which is community healthcare extension workers. You understand? They need to know how to give vaccines, because if you really have the vaccine, the other challenge is to get it into the arm. We don't have enough people to deliver that. Regarding reactions to the vaccine, we know that for any shot that you get, there's local reactions. So you get like redness in your arm, to slight fever and all that. These are good reactions because your body's immune system is responding to the vaccine. Now, there's some very severe interactions with the vaccine that are life-threatening, that obviously you can't take the vaccine or you need medical intervention. You need to, usually, like when I got my own shot in my arm, there's a long questionnaire you need to go through. Do you have allergies in certain areas? There's something called PEG, which is one of the ingredients to make the vaccine. If you're allergic to eggs, things like that, we need to be aware so that we're ready for you. And if you really have severe allergies, you really shouldn't get the vaccine. To be honest, we don't need 100% vaccination to get immunity. Okay, so 200 million Nigerians, they're talking something like 45% may give you enough immunity to stop the spread of COVID. Okay, so again, we don't know which vaccines are the best because it's still evolving, but we need the vaccine. We need to get it as soon as possible. We need to get it to the arms of the people. Reactions will occur. The severe reactions are what we're trying to avoid. You need to know that you will not die from the shot, okay? We just need to know that you're reacting. We have drugs and we have systems in place to prevent you from having a really bad reaction and dying from the COVAX or any of the COVID vaccines. So if you ask me, yes, everyone should get the vaccine. Even pregnant women should get the vaccine. Now, there's data that came out inadvertently, because when we started immunizing people, some women were pregnant, early pregnancy, they didn't know they were pregnant. And so far, the COVID vaccines, all of them, none of them showed any more lethal effects than other vaccines that are used to protect people. And people ask, oh, if I take the COVID vaccine, means I'll get COVID. No, these are attenuated vaccines, okay? Yes, they use a part of the virus to get you to be immunized, but they're not going to give you the same symptoms as COVID. So you're still better off getting the COVID vaccine. So for me as a physician, like I said, I use myself as a guinea pig, if you will, and I took the Pfizer vaccine. And I'm still encouraging all vaccines. Cheaper, most expensive, any vaccine is better than no vaccine for this virus.
Well, Dr. Ugwumba, we have just a few minutes to go. Very quickly, as we wrap up, I would like you to try and make a few statements about specific lessons that we can learn from the Canada experience with the rollout that you think may be useful back home here. I note some of the suggestions you have made. We need to get more vaccines apart from the AstraZeneca one. We need to do training. We need to encourage people to take the vaccine. But are there other things that you have observed as best practice, particularly with the immunization strategy in Canada, that you think Nigeria can also begin to look at?
And I would like to add something about mental health at the end, because I'm a physician looking after everyone. If you allow me one more minute. But yes, the strategy to give vaccination is really important. We knew that the people who were most vulnerable were the elderly, the people who had comorbidities. I'm talking diabetes and hypertension and low immune systems. They were the ones that were more vulnerable to getting the vaccine, getting the virus, and they were more likely to die from COVID. But right now, so Canada, for example, we used age and we used exposure. So we used age for very old people in nursing homes, and then we went down. And we're still very far from reaching a wide range of people. I think right now we're about 35 million people in Canada, and we're not even up to 10% of our vaccinations. Again, we in Canada did not make any vaccines, so we're buying the vaccines just like in Nigeria. But we're looking at the demographics of the spread. We're looking and seeing that young people are actually the super spreaders of COVID. So they're thinking why don't we immunize young people and change the strategy? Because even the young people, even though they don't die from COVID, they're spreading it. And if they have mild symptoms, doesn't mean the person they spread it to will not die from it. So we're looking at that, research is coming out. But for now, we're rolling out according to exposure, like I said. So if you're a frontline health worker, a nurse in a nursing home, or a doctor in seeing patients, you will have been invited to get the vaccine. You can only get the vaccines now by invitation. Your money cannot buy you the vaccine because, like I said, there's not enough vaccines. If you're in a nursing home and you're in a certain age group, you will have gotten the vaccine. I think right now we're about 75. So we started from 90 and above to 80 to 90, and I think we're about 65 to 75 now, age range. And there's still quite a lot of people that haven't got the vaccine. And like I said, the government is looking at the new research coming out that the outbreaks, wherever they open the schools or the dormitories, they have seen lots of infections. Even though nobody died from it, these people go back home, infect their parents, their grandparents, and from then the virus is spreading. So again, we're targeting the spread, okay? We know that eventually the virus will stop killing people because we'll have got the answer through the vaccination. Well, and so until we really understand which vaccines are the best, again, the boosters and all that, we just have to keep going and doing more research. Now, I'd like to talk a bit about mental health.
Dr. Ugwumba,
this virus has really
we won't be able
mental health.
to take that also very important subject about mental health. We've run out of time, and we'd just like to thank you very much for joining us again on The Morning Show.